right. Welcome to Gain TV, and you are on Talk to Me. Again, I want to thank everybody to tune in. Today is going to be another great conversation. A great conversation we have as a guest today is Miss Tamika Bevels, or Bevels for some. She is a RN, MSN, BC, and an educational doctorate candidate. So please help me to welcome Miss Tamika Bevels. Welcome to the show, my friend.
Hey, how you doing?
I'm doing pretty good. It was a pleasure to have you on the show. So how you been doing?
I've been doing really good. How about you?
Hey, fantastic, fantastic. It's a great day. I know it's gonna have a conversation first. So one is business. We're going to be talking about business. We're also going to be talking about your, your doctorate degree that you are on a path, hopefully, very soon to become a, education doctorate. Um, anything that I said in the introduction, anything else you think my viewers might maybe I missed to say you might add to that? Who are you, Miss Bevel?
No, you did a really good job in explaining it. I am a nurse by education. I do have a bachelor's and a master's in nursing. Right now, as you mentioned, what I'm doing is I'm trying to complete my doctoral degree in education, because one of the things I want to try to do is improve health literacy in urban and underserved communities across the nation.
Absolutely, absolutely. Listen, we're gonna get back into that again, but first of all, let me also remind everybody that is watching right now that Miss Bevel's also a business owner. So tell us a little bit about your business. What's the name of it?
Yeah, so the business is called R.E.A.C.H. That stands for Resource Education Action Clinical Resources. And basically what that means is that, if you are in a community and you need educational resources, you want to start a new clinic, you want to do something like a patient first, I would be that person that would provide you those services, that educational information for your clinicians, doctors, nurses, physical therapists, IV infusion individuals. So my company brings that hub of clinical information that you would need to start your clinical community center.
Wonderful, fantastic. I read somewhere that's very. I know you already explained what the business is. So when people see R.E.A., what's the rich stand for?
So it stands for Resources for Education and Action for Clinical Healthcare. Yeah, so that's the reach. Yep. We basically want to try to reach more than the folks here in the States, internationally, who may need clinical resources as far as education.
Okay, so that exactly the definition speaks for itself.
Yeah.
So so now this kind of services are so important. Somebody's watching this program and say, hey, listen, this is somebody I can potentially be in partnership or maybe use to eventually have my service. Specifically, what are the kind of service that you offer as a business person?
So that's a really good question. One of the things that I will offer, and I do offer, is competencies. If you're a nurse or if you work in the healthcare field, you understand that there's ongoing education to be proficient in your profession. And those competencies build on being able to give quality of care to patients. And so I will be able to give that education for providers, nurses, nurse practitioners, technicians, nursing assistants. And what that means is that they will be able to come to my organization, get the information that they need to give to their clinical professionals on an annual basis. We give it on an annual basis. We give it on a 6 month basis. It's just a hub where we can get all of your educational resources created for you. Mm-hmm. We also do implementation and analysis of that of the clinical information that's provided as well, and we also give re-education. And in addition to that, we make sure that your staff members are educated, and we also make sure that if you're starting a new facility, we help with the implementation and the structure of that new facility as well.
Absolutely, absolutely, very interesting. So can you tell us a little bit about the? I saw some information about clinical quality improvement. Did you already mention that?
Yeah,
Yeah,
yeah. So
yeah.
just to
Can you
give
come back on it a little bit?
absolutely. This clinical quality basically means that if I choose a care facility, and when I go to that care facility, I expect the highest clinical care. And that means if I'm getting the right medication at the right time. I'm getting the appropriate treatment modalities according to the disease process that I have. We make sure that all of those pieces are appropriate and we collect data on it. So if you came there with a high hemoglobin A1C that was not in appropriate range, we provide you the education to get those patients in appropriate range with the clinical education we provided your staff so that they would get the best quality outcomes that is possible for their particular disease process.
I'm sorry, Tamika. I was on the mute because there's a some noise surrounding. So sometimes I'll be turning my microphone off to let you express yourself clearly. So my question was about. It looks like what you do is more um, about educating people and then collecting their data as well.
Yeah, that's correct. So if you went through one of our education exercises, and we assessed you before your staff members before their knowledge base. After our education has been given, the expectation is that their test scores post that education will be improved. And so not only would the test scores improve after giving the education, we will also we look at something called quality measures for your patient population. And what that does is also tells how well we've educated you and your staff members on that particular disease process or clinical outcome.
Hmm. Very interesting. This is cool. I guess you know uh, when we see a lot of I mean wrongdoing in the medical field.
Mhm.
So this is something that people have to be taking seriously. I didn't know there is an entire um, array of services out there outside the institution of a medical institution. People that can come in to kind of back off or even help the people to keep their eyes on important aspect of our treatment. Now, it's obvious that you're a black woman, you know that our medical system is usually is not as perfect as it's supposed to be when it comes to black women. What can you say about some of the stuff that you know that you can correct as a professional working
So
on that?
this is exactly what we're trying to do here, and that will lead me to into the discussion about the healthcare literacy. I think there with healthcare literacy, there's the patient side of it, being knowledgeable about their healthcare and their disease process, and then there's the other side where the medical professionals have to be in tune, they have to be dedicated, they have to be knowledgeable, and they have to be careful and safe when taking care of humans. I think the issue around taking care of Black women is a long-standing misnomer that we feel things differently, and not only do Black women don't feel things differently, a human. As humans, we don't feel things differently. Pain is pain, and I think when you think about that in its totality, it's ridiculous. However, we have to deal with, people thinking that because of, the history of it all. But in my company, and the reason why I'm trying to further my education is I'm trying to provide the education to say, no, a Black woman, a Black child, a melanated person feel the same pain, mostly have the same disease processes as any other human. And with that education, I'm hoping to kind of change, some of that thought process, so we don't have to lose, melanated people across this country and or nation, because of, these frivolous ideas that are not, rooted and bounded in literature or research.
Wow. so so I mean, you pretty after this research study, we're gonna get into the, because you want to further your education, because the issue must be not only a demand, but it's crucial. It's crucial that we the medical field have to protect everybody. I don't know how we get into this point where if you're melanated, you have to be careful the way you approach the medical field or the medical practice. But how, when you come to, for example, a medical facility to maybe work with people, do do people receive you openly, and knowing that you're probably gonna come and take a look on some of the maybe mishandling or misuse of the medical practices, based on the belief that if you're a Black woman, for example, you're not probably gonna feel pain. I've seen a lot of women being so scared when they're pregnant. There's even high profile cases like Serena Williams talking about on experience going through to a birth, and her closely getting feeling like she could potentially lose her life. So all of this information we have collected, and potentially and stuff that you're going to be going back to your peers in the college, and kind of educate them. So the culture of even thinking that you as a Black woman feel differently, is that traditionally in the annals of medical practices?
So it
Where that come from? How come we, even in 2023, we're still dealing with this kind of stuff?
Well, you know what? I think that it was never corrected. If we don't have an open and honest conversation about what's truly happening, you never, get it to bubble up to this level of the surface, right? Even myself, I've gone into, healthcare organizations where I needed care, and I felt because I was melanated, I was treated differently. I had to ask for pain medicine. Person told me that I wasn't in that much pain, and they didn't know that I was a RN, but I chose to keep that to myself so that I can see what was going on. And basically they just looked at me and just made an assumption. I feel like right now is really a good time. Unfortunately, these things are still happening. It's an unwritten rule, I believe. I think it even goes back to Jim Crow laws, and even way back when they were creating gynecological instruments, to do procedures on women. Most of those tools that we use now came from the experimentation of Black slaves. So it's all more about these days being educated, and not only as a medical provider, you as a patient, as a family member to a patient. It's so important to be informed. I had an experience with my own father, who, praise God, is doing well now. He was diagnosed with congestive heart failure, and he had to go in for a procedure. But when he received the information for the procedure, they told him, "Hey, you may die on a table." My father didn't have not ever heard that before. It wasn't explained to him clearly or spoken to him in layman's terms, and he almost decided not to get the procedure. It was a life-saving procedure. And he ended up getting it after I spoke with him. Praise God for that. But that happens so much in our community. A lot of people don't have nurses in their family who can break the information down. So again, that's why I say it's always two sides, to a story. It's always two people who are responsible in a situation to get a positive outcome. That is the patient, who has to be informed about the information and take charge of their own clinical destiny, and the provider, who has to be that utmost professional in giving care to patients. Hey Malik, I can't hear you.
Yeah, this I always have to remind myself to
It's
go back
okay.
to.
It's okay. No, thank you for having. This is a really good conversation.
It
I'm not
is. It
sure.
is. That's why I think this shall not be the only time you come up here, because this channel. I mean, our program is about education. Yeah, we deal, of course, we deal with politics and business, but as a business person yourself, the biggest chunk of what you do is, and that's what you're gonna be. At the same time, you're also gonna be educate, and then also do it as a business. So let me ask you. It looks like you took a lot of examples. Now, any anything personally? Do you have any personal experience with this kind of things that you are talking about, like personally in your personal life as a black woman?
Oh yeah, yeah, yeah. Like I mentioned, when I was having my child, my first child, I was admitted to a hospital in a low income area, and I was having pain, and I said, "Hey, I'm having really bad pain." And what was said back to me was, "You are having a baby." And I was like, "Oh my goodness!" The clinical professional did not know that I was also a clinical professional myself, and
Mm.
that I had been rushed there because I was having complications. And later on, I was having more and more pain, and they told me, or they describe me as a individual who may be on drugs, as the relating to the reason why I was asking for pain medicine. And later on, I was asked to speak to the nurse manager and a nurse supervisor, and that person was removed. But I'm a clinical professional. I know who to call. There are many patients out there who do not know who to call, and they suffer the consequences, and sometimes it's their life. That's another reason why doing this study and completing my dissertation is really, really, is truly important. Health literacy, statistically, just to give you a couple of facts, statistically, it tells us that if a low income individual is,
But
if they're
listen, to make it, not to cut you off. That's the second part we're gonna be studying. I want you to hold on that thought,
okay,
because we're not now gonna we
I'm
talk about the
excited.
business part. Yeah, of course, that's what we want you to be. You have to be, stay excited, and we're gonna eventually get into that with Miss Bevel, who's joining us. Eventually, we're gonna be talking about a dissertation. And so, in doing that, we're gonna take a quick break. When we come back, we want you to dive into this process you've been working on, and we can understand clearly that your motivation to go into improve your knowledge on this stuff. Go through to get your educational doctorate. So we're gonna take a quick break. When we come back, of course, we're gonna be listening to you even more. So that is going to be in the few minutes to come.
Look, leading can be tough, and leading without support, limited resources, an inexperienced team, all while managing work-life balance, is even tougher. This is an exclusive opportunity for you to take full advantage of my years of leadership experience and glean from my mentors and all the work that I've done, the learning, the trials, the error, and the growth. You're joining an ecosystem of believers, leaders, thinkers, and doers who are here to support your dreams, celebrate your wins, and encourage your success. Look, leading can be tough, and leading without support, limited resources, an inexperienced team, all while managing.
All right. Thank you for joining us. If you just get into the program with Miss Tamika Bevels, who actually is talking about this medical literacy. It's a very few conversation on this subject matter, and we want to thank you so much. You have a busy schedule. It's been a long time since we wanted to have you on the show. Finally, you're here now. Let's dive back into the education literacy and how you make that decision that, hey, listen, somebody have to stand for this, somebody have to do something. When did you start thinking about that way? I'm just gonna go and get my doctorate degree.
Yeah, like it's the situation that happened with my father, and him, basically making that, life changing decision to not do something that would save his life. That really was the major trigger. And then I go back to the days when I was working at Hopkins, where we had multiple patients that would come in with who've been newly diagnosed with um, diabetes type 2, hypertension, and they would be discharged, right, with these new diagnoses, given instructions, and then in the next couple of days, they come right back. And the reason why they came back was because they didn't clearly understand what the physician was telling them, because the physician, the nurse practitioner, or someone did not speak to the patient in plain language. Like I was getting into before, statistically, it just tells us, and this is common sense, really. If you're in a low income area, you're living with with a low income status, you're less likely to be worried about your health outcomes. You're worried about food. You're worried about feeding your kids. You're worried about how you're going to get them to school, how you're going to get to work. You're less worried about a hypertension diagnosis. I'll deal with that later. However, if it's explained to you in a way that is impactful to how you understand information, you're more likely to go and decrease salt in your diet. Find out what you have on your shelves that is, inundated with salt. You are more likely to ask questions back to the provider. You're more likely to use the information that you're given. You're more motivated to try to make a change in your life when you understand, and that's healthcare literacy. It's a big deal, Malik. It's a really big deal. It's very impactful, to the difference between life and death.
Wow. Wow. I mean, so yeah, that's I can see the motivation behind it, and the education aspect of it. Telling people the more you know, the better you act. They say if you know better, you do better. So now that you've been in this program, going through the doctorate process is not an easy task. Where are you right now at this junction? When can we expect to fully call you Dr. Bevels?
Well, right now I'm completing my study where I'm collecting data, and I'm collecting data on nurse practitioners who would just share their experience with me on how they share healthcare information with their patients. What that's going to do is, it's going to fill the gap in the research, because right now we don't have a whole lot of information on how nurse practitioners receive and give information to their patients. That's the first thing. And then the second thing that it's going to do for people who already have their PhD, they can look at my study and say, wow, these nurse practitioners use these particular tools to educate their patients. Maybe I can take that tool and study it and then put it out as a validated tool for others to use to further improve health literacy across the
Fantastic, fantastic. I just guess America is an advanced country, and while you're talking, I was just thinking about developing countries, especially, I'm originally from Africa, and I was just thinking somebody might watch this program and say, hey, listen, this is the kind of people that we want to, because, like I said, the more we learn, the better we do, and the more we know, the better we act. Your service will be targeting more patient than medical professionals, or both.
So my business, it will target more the healthcare professionals this in the United States and abroad. If you were to look at my company and say, hey, I want to do something in my community that we don't have. Maybe you don't have a clinic. Maybe you don't have a healthcare resource center. Maybe you want to start that center. My company will help you build the foundation for that clinic in your community. I do understand that there is a need internationally for these services. Like you said, the U.S. has so many resources. However, again, my study speaks to this. It is still the motivation and the clear understanding and speaking in somebody's clear language in order for somebody to take advantage of that. But I feel like internationally, I think folks will take advantage of it because it's just not something that's readily available. I think it's something that that can go international. It's not very complicated. If you want to know about hypertension, diabetes, things like high cholesterol, things that eventually cause our demise, it'll be something that is beneficial for your community and population.
Wow, I mean that's impressive. I personally very interesting in how this kind of studies and the data, being a data manager, as myself. But at this junction, what I'm looking for is how the data impact or influence the policies. So if we can use the data to understand what's going on, because that's the purpose of this study, to try to look deep and understand what's going on, and then policymakers have to be able to go and use the data and also work on the policy aspect of it. So, any intentions when it comes to maybe work with some policy makers, especially here, because if you said there's a lot of stuff that still to be corrected in the medical literatures, then that's something you probably have to think about. Working with policymakers and showing them the data and using the data, people can go ahead and try to probably put some policy in place to correct some of these wrong stuff in the medical literature. Any thought? Maybe you do you think about that? Maybe
Well,
working with the policies,
yeah,
politicians.
yeah, I have. One of the things that I think we touched on a little bit earlier is that America we have policies already. We have policies and procedures, and we have things that are on Capitol Hill right now that are kind of sitting on someone's desk, based off of the data that we take every year from CDC and all these other government agencies that collect this data that we have. We already have this. I think the contributing factor that I can bring to the table is the realization of it. These are things that can't go on, any longer. We have to have more of an action. We need data analysts to really tell us the nitty gritty about what can we do right now versus, oh, we have to pass this bill. It has to come back to the House. Got to go. We really need a fast track, common sense, ability to facilitate things that save people's lives when we have data to prove it.
Yeah.
That would, I could definitely be an advocate for policies to to be pushed through that's going to support the improvement of our healthcare system.
Absolutely. Listen, if ever folks like myself, good folks, listen to this, I would like for you to just come and testify, because whenever there's a study like this and there's some new findings, or in addition to what already exists. If there's more information, I think you should be maybe subpoenas. I don't know if that's the correct word. At the local or even at the, even at the state federal level to come and tell the policymakers what is going on, and how can people can do some adjustment, maybe improve on some of the policies that already existed. Now I want to know this. Um, Looks like we have lost our friend. Oh, she's back. Look, I want to know. So I know your hands are full right now, and with this, doctorate, you probably want to add something in addition to what you already said. But I also want you to tell us, what can we possibly do? What can the people that are watching you do to contribute for your success? What do you expect from people that watch this? You probably will talk to some of the maybe the patients, or maybe the health professionals. What can you say that can help you with the work that you're doing right now?
So right now it is critical, and thank you for asking this question. I really need nurse practitioners who live in practice in Maryland, Pennsylvania, Rhode Island, Florida, Virginia, North Carolina, South Carolina, Florida, and Georgia, Pennsylvania. I'm sure if I'm Delaware, New Jersey, New York. I need those nurse practitioners to take my study. It's 5 minutes. It's literally 7 questions. There's no right or wrong, answer. It's just basically trying to get your experience and how you provide education when there's barriers. When the patient may not want to learn, when the patient may not be motivated, when the patient, may be worried about other things. Maybe there's an educational barrier. Maybe they have less than a fifth grade education. I just want to know what you do to kind of get around those barriers to still provide the education to your patients. And that is taking a short survey.
Right.
I also need interviews. If you can, sign up for a 15-minute interview, again, very quick, to also just share more in depth of the things that you do to provide education to your patients.
Wonderful, wonderful. Listen, as we speak, our technical support people will put that information at the bottom of this our YouTube page. The survey will be there. Probably you might probably also add send us your email address, something, some way that some people can get access to you if
Yeah.
there's additional questions. But I do believe the service is already available on our YouTube page. I just hope people who understand the need, the urgency, the importance of this work, to really take some time. How long did the survey take? I think it's less
five,
than 10 minutes.
5 minutes.
5 minutes. That can save lives, because this information, as a data person, I want to see the data and probably do the analysis possible to see how can we use that to change policy, because in the end we just want to improve people's lives. Listen, we're going toward the end of this program. I'm gonna give you the time to probably tell everything possible, and then we will definitely conclude this program today. Anything else that you in addition important that you probably didn't have a chance to respond or to
Yeah,
say?
no. First, I want to tell you thank you so much for your platform. This, I've been watching you for a while. You have done great things with your program. I've seen wonderful guests on here giving a lot of good educational and business and politic type information that is very informative for not just melanated people, but for all people. So I want
Absolutely.
to tell you thank you so much for having me here on your show.
Absolutely, absolutely. Listen, the pleasure is ours every time somebody like yourself bring value to the table, something that will benefit the community, both here at home and potentially internationally. Because I know people who are watching this show here at home and on an international level will definitely give some calls and trying to get your information. And thank God, some of this information is already and on in our in on our page at the bottom of our page. But I want to insist again, this only makes sense if we take action. The action will be take that survey. It's only less than 5 minutes. A survey. Take it so that Miss Bevel can move forward to bring us this wonderful document. So this dissertation should writing. So listen now. Hey, like I said, the pleasure is ours, and I want you to know that at any time, bring it back. If you have new information, new findings, make sure you come back here at Gen TV, so we can be the very first platform to know this. And as you know, we support everything, every efforts. It's people in our community that do the right thing, positive
Yeah.
thing.
And also, Malik, let people know, I just want to just put a plug out there for my company, R.E.A.C.H. If you need those type of educational services for your community, or you're starting up a new health facility here in America or abroad, please, contact our company. Malik is going to post that information. My email directly, if I could say, Malik, is that okay?
Yeah, of course, of course. As a
Yes.
matter of fact, you know what we're gonna do? You can on that private chat on the right side, you can write that email so that I can put it on the screen while we're still here, and people can see it. But you can say it, but you can also write that. I don't know if you can see the private chat on the right.
I'm typing in there now.
Okay, go ahead and do it so that it's very important. We don't want anybody to miss out for this important information that you are giving because after now I know how busy you are. It's going to be absolutely difficult to have you, but we expect you to save some time for us to come back and continue to educate folks on what's going on, because health is the most important. There it is. Okay, so I'm gonna have this right here and put it on our page while we still here, and this also gonna be on our YouTube page so that people can take advantage of it. Please email Miss Bevel, soon to be a Dr. Bevel, so that she can use this as a part of our study. Now, let me ask you this. The survey also, I think on the survey, I just put a link, but inside of that link, I do believe there's also information, right? So also information.
Yes.
Am I right? Am I right?
Yep, that is correct.
Okay. So see below here, you guys at the end of this, you see, there we go. You see TD gluttony03gmail.com. So easy. Anybody can see this. And please take advantage on the link that carry the survey, carry the same email address. So take advantage of it and let's build a community together. Miss Tamika Bevels, we want to thank you again, and we wish you good luck. And please, once you have that degree, come back to us and let's celebrate on Game TV.
Yes.
Right?
Yes, sir. Absolutely.
Absolutely. So that absolutely conclude our show for today. And our guest today, like you just found out, was Miss. I'm gonna bring her back here on the screen, Miss Bevel. I didn't want to let you go like this. Maybe you have some last word to say before we leave.
No, let's each one teach one. And
Okay.
if you support me, that's what you'll be doing. So thank you very much.
Absolutely. There we go. Now, I don't want to, Dr. Bevel to say, I never said my last word. Everybody's now on the same page. Go on our YouTube page. Not only you have to subscribe, because that's the only way you can help this show to keep on going. That's the way we keep our lives on. If you can make some kind of donation, please do not hesitate to do it, so we can continue to have this kind of people, this kind of professional, this kind of business people to come on the show and give you the knowledge, the intelligence that you need to move forward. So as for me, I'm Malik Linzonzo. That was Talk to Me, and probably talk to you another time. Bye now.